Imagine two patients arriving at the emergency department at the same time. One is an elderly patient living alone with subtle signs of sepsis, and the other has a visibly painful injury that appears urgent but is non-life threatening. In a healthcare system where resources are limited, how do healthcare providers decide who should receive care first? This process is known as triage, one of the most important decisions in healthcare. However, traditional triage systems often rely on fixed protocols or AI models trained on historical data. As patient populations, disease patterns, and healthcare demands change over time, these systems may become less accurate and less equitable. Our project therefore explores the question: how can continuously learning triage systems prioritize vulnerable populations while respecting resource constraints across diverse healthcare settings?
Triage decisions determine who receives care first, and this directly impacts patient outcomes. For example, if high-risk patients are not recognized early, delays in treatment can lead to preventable complications, disability, or death. Furthermore, healthcare systems worldwide are under increasing pressures from aging populations, staffing shortages, overcrowded emergency departments, and limited resources. Research shows that AI-driven triage can assist with these challenges, contributing to reduced wait times, improved patient outcomes, and more efficient patient management. This suggests that adaptive intelligence could play an important role in creating more sustainable healthcare systems.
This problem affects patients, healthcare providers, hospitals, and entire communities. However, some groups face greater risks than others. Older adults, people with disabilities, indigenous communities, rural populations, individuals experiencing homelessness, and people facing language barriers may be more vulnerable to triage errors. Social and cultural factors can influence how symptoms are described and interpreted. If AI systems are trained on biased or incomplete datasets, they may unintentionally reinforce existing inequalities. In fact, studies have shown that some AI healthcare systems underestimated illness severity in Black patients compared to white patients, resulting in delayed care and poorer outcomes. For adaptive intelligence to support inclusive healthcare, fairness and equity must be built into the system from the beginning.
Research by Ferry and colleagues shows that adaptive triage systems can outperform traditional approaches because they continuously learn from new data. Their models maintain accuracy over time by adapting to demographic shifts, evolving disease patterns, and changing clinical practices. Advances in electronic medical records further strengthen this approach, allowing AI to identify clinical patterns, extract information from physician notes, and support real-time risk stratification. Together, these capabilities enable adaptive systems to continuously improve their performance as healthcare evolves.
Several traditional solutions, such as the Canadian triage and acuity scale, exist, but cannot automatically adapt to changing conditions. For example, a European hospital pilot found consistent reduced priority in sepsis patients, meaning delayed treatment and poorer outcomes. Similarly, Ferry and colleagues noted suitable adaptation to gradual changes, but issues with abrupt events such as pandemics, natural disasters, or emerging diseases with limited data. Additionally, in clinical simulations, one AI triage model incorrectly downgraded over half of gold standard emergency cases, highlighting why adaptive intelligence alone is not enough, with human oversight essential for safety and transparency.
Our proposed solution is an adaptive, equity-aware triage support system. The system would continuously learn from new patient data, healthcare outcomes, and resource availability while supporting clinicians in making triage decisions. It would help integrate information from electronic medical records, physician notes, ambulance dispatch systems, and hospital capacity data to identify patients at greatest risk. The system would also consider local resource constraints such as emergency department crowding, staffing levels, and ambulance availability to help allocate resources more effectively. Importantly, clinicians would always retain final decision making authority.
What makes our solution unique is its focus on adaptability, inclusivity, and sustainability. Unlike many existing AI systems, our model will continuously monitor its performance across different demographic groups and healthcare settings. If disparities emerged, the system could be retrained or adjusted to reduce bias. The solution will also be used in underserved and rural communities. Research suggests that predictive AI models could help rural hospitals anticipate patient transfer, improve coordination with emergency transport services, and better resource allocation. Combined with telemedicine, adaptive intelligence could help expand healthcare access by reducing travel burdens and infrastructure costs for remote populations. This makes the system both more equitable and more sustainable.
To evaluate success, we would measure several outcomes, including reduced wait times, improved patient outcomes, and more equitable triage across diverse populations. Implementing the solution would require collaboration between multiple groups such as healthcare providers, data scientists, ethicists, policymakers, etc. Several challenges remain, including cybersecurity, algorithmic bias, accountability, and clinician trust. However, combining continual learning, fairness monitoring, resource awareness, and human oversight, adaptive clinical decision support has the potential to transform healthcare triage rather than replacing clinicians, ensuring the right patient receives the right care at the right time. Overall, supporting a system that is not only smarter but also more inclusive, equitable, and sustainable.